Am I audible to everyone? Sorry for the little delay.
Yes, ma'am.
Yes, ma'am.
Yeah. So now we have started with the very meaning of the research. Why do we term this as research? It is nothing but research. We are searching out the meaning of particular thing. So moving from unknown to known, whatever we have, we do not know, whatever we do not have the clarity. So from that, we are going to have a clear-cut idea. In other words, we are just finding out a scientific method of approaching something. So what is a scientific method of approaching something? Why do we approach everything in a scientific way? Can anyone share your views? Why do we need everything in a scientific manner? Why do we need everything in a clear-cut manner?
Because many people will be following whatever we publish, ma'am. It should not have a negative effect on them. There should be proper research and information.
Exactly. So everything a scientific way means it has to be proved with a proper experiment and with a proper result. So that's why we need a scientific approach of anything. So what do you mean by scientific approach? See, how do? We can take our yoga research. Like in yoga research, see, we do yoga research in many topics nowadays we do. And now, for example, you can take my topic. My topic is nothing but curing dysmenorrhea, especially the primary dysmenorrhea with yoga and diet. So how can I prove it? Simply, I cannot say that I have given therapy to someone. I have given every day morning. I am taking 1 hour classes. And if any adolescent girl says that my pain is relieved, I cannot simply say that I have cured dysmenorrhea. This is not the way. So what I have to do? What are all the factors that is affecting the primary dysmenorrhea? I have to take a medical record of it. Like what are all the hormones that causes dysmenorrhea? That pre-reading I have to take and post-reading I have to take. Then I should make a statistical calculation about it. And I should also prove that how dysmenorrhea level is reduced from pre-reading to post-reading. In what way I have cured it. And similarly, even all the psychological factor, we have to prove with the statistical approach. So this is a way that research is becoming very popular nowadays. For each and every aspect, we need a research, not only for medical oriented, and research is there for all subjects, including languages, we have a research. So what is that? In other words, we can say that it is nothing but an intellectual way and way of approaching something, and also we are going to give a practical answer to the problem. So why do we need generally we cannot do some research. Where and all we need a research? Can anyone say? Am I audible? Are you all in the classes?
Just thinking, ma'am. For example, I feel like recently we had COVID. COVID was something which was not there earlier. So when new things are coming up, we need to research, find out solution for them, like that, I feel, ma'am.
Okay. No, any other views?
Nowadays everybody wants to see, like, to tell that, because as a yoga teacher we tell everybody that yoga gives this effect and that effect. So but then normal people, they don't believe it. Without practice they don't believe. So to show them that this is the result of practicing yoga, so they want to see how we can show them the result. So
Right.
that is why we need the scientific
Yeah.
research.
Any more ideas?
Maybe, ma'am, because scientific research give facts, like
Okay.
scientific research based on facts, it will not provide or
You are
present
you are
the
telling the post effect of research. What I'm asking is, why do we need a research? Where and all we need a research?
for social cause, ma'am. Ultimately, it will help the society and the whole world. Or maybe
Still more accurate, still more accurate. You're all near to the word, but not the exact word.
To know the things more deeper and deeper. Is it that, ma'am?
No, actually, only when there is a problem, we will find out a solution, right? Only when you have a problem that you could not solve with a normal approach. We keep on searching the answer for the particular problem, a solution for the particular problem, right? In the day-to-day life, we don't do any research because the day-to-day, our lifestyle, everything is being established by our ancestors and elders in a routine way, right? So you need a research only when you have a problem, and you need a research when you need a solution for a problem. Am I right? Or you all agree with me? So when you have a problem, that problem to be resolved, the problem may be the practical problem, a technical problem, a medical issue. So only when the problem arises, we start searching out a solution for that. That searching out a solution is nothing but a research. That is why, because the problem is existing, we are unable to give the solution to the problem. So unknown to known, you don't know the solution for the particular problem. So another thing is, another way of putting out a research is that we are putting an inquiry into the facts and figures. See, for example, a simple way, when you get an accident and when you fell down from a two-wheeler, immediately everyone will ask, they will not ask about, okay, they will do the first aid. Immediately they will ask, what is the reason? Why you have come in the wrong side? Is your brake is not working? Have you not seen the opposite vehicle? You understand? So this is the way that they inquire and the facts about it. Because unless otherwise you inquire what has already happened, you cannot give a remedial solution. See, that is what is happening even in our medical field. So whenever, if anybody comes, for example, if any diabetic patients comes to you or any patient comes to you for therapy, immediately what will you ask? Which made them diabetic? Which made their loss of metabolic disorder? What is the reason for their metabolic disorder? Naturally, we have to question them, right? Even in our yoga, this is the way that we are doing. We will question them how they have put into the current scenario. So that is an inquiry because we want to know the facts. For example, if somebody is having diabetic 2, okay, if three patients are coming with you, all the three may not have the same reason. One may be because of the diet, excess food that they have taken. Another may be because of the work pressure, tension, financial disability. Like another one may be a very lazy and sedentary lifestyle, so that they eat and they do everything, but they don't work for it, right? So the reason, the disease is only one, but the reason for getting such a disease is three different. So depending upon that, we are trying to give them the solution. So we have to find out the problem has occurred. No doubt, problem has occurred. The problem to be given a solution. How the solution should be given, unless otherwise you know the facts, the reason for the problem, we cannot give any solution. So that is why it is say that you are making a critical inquiry, not a simple inquiry. You are asking each and every pinpoint what is happening, what you are doing, how you are following, what is the diet you are following, what is the time that you wake up, what are all the physical activity you are involved, and what is the lifestyle you are doing, what is your family scenario. So all the critical facts and figures to be inquired so that we can give a proper solution to them. This is a main thing for any research. Anybody who would have done any dissertation in your MSc or your MPhil would have known, na? Anyone has done so? Karthik ji, you must be having some, surely must be some experience with the research.
Yes, madam. Yes, madam.
You can share it now, no? What topic you did and how do you approach? What are all the critical things you did in your research?
Effect of yoga therapy on overweight civic women I have done.
Is it in MPhil or now PhD you are doing?
In MSc I have done, sir, madam.
MSc you have done it. So in
Yeah,
that,
madam.
one statement, one thing you remember, we put the problem statement. The problem statement is important for any research. We have to narrate our problem statement. Yes,
We put hypothesis, ma'am.
hypothesis is nothing but a guess. I'm not,
Yeah.
we have not come to the hypothesis level. We are just into the question level. It's only a
Yeah,
problem.
but we put a problem to find a solution.
Yeah, actually, hypothesis is nothing but you are guessing the result, how the result will come. Okay, that is the another third level of your research. We have just now started what is a research, and in the research, why do we do a research? We have a problem. For the problem, we need a solution. Okay, we are just into the problem. So in the problem stage, we will give a problem statement. Okay, and then next point that we talk about the research is a creative and a systematic work. Okay. So whenever you talk about research, you should not go in a haphazard way. There should be a proper sequence of doing something, right? So, for example, you can take a very well thing of a diabetic patient. When a diabetic patient, how do we diagnose someone as diabetic? We take the fasting sugar level first, and then maybe 3 months average also we may take, and even the post we may take. Post after 1.5 hours post we take. So this is a method of diagnosing someone as diabetic. Simply on the face with the symptom alone, we cannot diagnose that someone is having some diseases. For example, if you take a cancer, like one of the main symptoms of cancer is that your skin will change. Your skin will turn out to be like a snake skin. You have seen that rectangle, square. Like this is one of the symptoms for cancer. And appetite will also be very less. So with these two symptoms, can we diagnose some patient as a cancer person?
No, ma'am.
No, ma'am.
Because we have to take all the tests and conclude, because these symptoms may coincide with many things also. If a person is not using proper oil, if a person is of dry skin, even their skin will turn out to be like that, right? So if a person is having the habit of too much of snacks, or if a person is not having any physical activity, naturally his appetite won't be good. So like this, with a simple symptom or with a simple guess, we cannot decide something is a problem. The problem should be really properly worked out, a systematic worked out. So we can take, since we are all in the paramedical field, we can take a medical thing as an example. And then the next is that it is nothing but an intellectual process of discovering, developing, and verifying the knowledge. So here comes a discovery. So whatever process is the medicine already exists. The yoga is already there. We are not finding any type of new thing, right? Yoga is already given. It is from our ancestor. It is given. Yoga is having an impact with all the internal organs of our body. So what we are doing when some patient is coming, for example, if a diabetic patient, his pancreas is affected. So we are giving asanas in such a way that pancreas is getting recovered and insulin secretion is neutralized. Insulin secretion is equal with the sugar secretion, that is a glucose secretion. So this is a way that we are discovering a particular way of doing. We are giving a variation in the asanas. So we are discovering a proper posture so that his insulin level is getting normal. And what we are doing, we are developing. See, some postures, simple posture alone is not enough. For example, if you do Kapalabhati, naturally your glucose level will get reduced. So how will you do Kapalabhati? It should be in Padmasana. Your spine should be erected and your mudra should be in Chin Mudra. That is what is telling. It developing and verifying the knowledge. These things we should have experimented already, right? Keeping a patient in front of us, we cannot make much experiment, because when a patient is come to you, is coming there with a belief that we will be giving a proper treatment. So this is what is we are telling, that it is an intellectual process of discovering something and developing something, developing a solution to the particular problem, and you are also verifying the knowledge. Whatever the solution that you are given, it should not be a fluke one. It should be a planned and a systematic. And then next one is a procedure, collection, analysis, and interpretation of data. This is a main thing that we do in the research. So what we do, there's a procedure for collecting something. See, how will you do? So simply a data cannot be collected, right? There is something called as ethical clearance. When you do a human research, you need a ethical clearance from the medical board. So why do you need a ethical clearance? Because when you take up a test, you are just taking the blood from them, for which we have to declare that we are not doing any harm to the human being or to the patient. And the next one is that we have to get the consent from the patient. Simply, we cannot do any research. Any research should be when you cannot make anybody as a subject for your research, right? When you are teaching yoga, if many people are yoga teachers, so do not use them as your subject without their consent. You can explain to them that you are doing a research with them, and it is their contribution to the society. They can be the subject. You have to explain them what you are going to give, what are all the treatment that you are going to give. Because for myself, I am giving a diet is one of the main intervention. So I'll be changing the diet. So I have to explain to them that what are all the diet I'm going to give and what are the type of asanas that I'm going to give them. Because asana, Stiram Sukham Asanam, everyone knows asana should be comfortable to them, and we are not supposed to give himsa to them. See, making them too much bend, making them too much balance. For example, if I am taking a class for above 70, if I am giving them Tadasana, how many counts they can stand? Maximum 10. 10 itself is a very higher count. If I make them stand for 20, 30, naturally I am doing a himsa to them. I am not doing justification to them. So these are all the main things that we will be listing in our ethical clearance. So this is what is telling, that is an interpretation. Whatever the data collected will be analyzed medically, statistically, and with the results. There are many statistical methods to prove that our result is going in a right track. And finally, the interpretation. Interpretation is very much important. In communication, the interpretation plays a major role. How will you interpret? You will take an older reviews that our seniors who has done the research before to us. So with that reference, we have to interpret that our research is the right track. So next is that what would be the aim of the research? As we have already discussed, the aim is nothing but we are trying to discover a proper solution, the truth, the fact that is already hidden in the problem, and depending upon the problem and the fact, we are trying to give a solution. Then, so where and all, what are all the fields that we need a research? So what are all the fields that we need a research? And these are all the fields that we have already discussed. We need for academic promotion. That is what we are studying now. Unless, see, any research or any field, if there is no academic, that field will not exist at all. See, if there is no teacher, if there is no student, there is no world, if you ask me very clearly. Everyone, we have to learn something from our guru. Only after learning, we can serve the society. So academic research is very important. Academic promotion is very, very important. And then, as everybody knows, we are gaining knowledge out of it. And everybody is there in the class. Am I boring? Research is little subject. Introduction will be-
No, ma'am. No, ma'am.
Fine. Thank you for it.
No,
Then
ma'am.
there should be no stagnation of the facts, right? See, when research is going on, everyone, as Karthik ji said, even in MSc or in PhD, whatever you do, you will many stages you will just stagnant, because further steps we need the guidance from our seniors or from our guide. So, for example, if you take an diabetic patient, okay. For example, what are all the asanas? Many yoga therapists are there. What are all the asanas that you will suggest for a diabetic patient?
Vakrasan,
Twists, ma'am.
Ardha Matsyendrasan.
Then,
Suptamatsyendrasan, Padmasan, Paschimottanasana, Surya Namaskar.
very good. Surya Namaskar. You are in the right track. Now tell me, if your patient is diabetic as well as if he has hypertension. What will you do?
Need to avoid forward bends and make some modifications.
Yeah, need to avoid is fine. What will you give then? So agree, need to avoid. Then what will you give then? You have to cure the diabetic as well as hypertension. What are all the asanas you will give?
Hypertension, yoga nidra, ma'am, chandra bedana.
Fine. With that, you think that you can cure diabetic?
We need to explore, ma'am, actually. I mean, with
That's
the
what
as to
that's what Rajeshwari ma'am. What will you explore?
And I think Ardhamastrinasan would be good. Like it won't affect the
Okay.
patient of hypertension.
Okay.
Yeah.
Not only for hypertension, you need to treat them for diabetic as well as for hypertension.
It works for both, ma'am. Sukta Masendasan and Masendasan, it works for both. But the set should be
No,
lesser
I
than the normal one.
want a list of asanas, right? And Kunjan, you said the Surya Namaskar, right? If your patient is hypertension, can you give Surya Namaskar? This is what the stage that I want. I am trying to say that you are stagnated. I told you, no, this is a stagnation.
Trikonasana sequence, madam.
Yeah.
Then
But anyway,
Bhujangasana.
fine.
Then
How can you give
Vakasana.
Trikonasana when
Like
it comes to forward bending to be avoided for hypertension?
no, madam, it's not like that because see, one of people, some people they will say that if we are having a lower back pain, we have to avoid the forward bending.
Yeah.
But in our university, we have proved that forward bending has cured the lower back pain.
Yes, exactly. And you can give even Sashangasana. What I am
Yeah, ji.
trying to say over here is there is a slight stagnation when I said diabetic, you all listed something. So when I added hypertension, there is a slight stagnation you all faced. Am I right?
Means Kumbhaka and all we should not do, madam, and we
Yeah.
have to concentrate on the breathe pattern and we can do it.
Exactly. What I'm trying to say is when a patient is having one issue alone, we can sequence very easily. When a patient is coming with multiple issues, we take a little stagnation and then we put a sequence. We'll be putting a sequence, no doubt about it. But we need some stagnation, right? We take some time to do that stagnation.
Everything depends upon Shadvamsati Tattva theory, madam. We have to diagnose there properly, madam. Then we can give the treatment for them.
Exactly. What I'm trying to say over here is that stagnation will happen in research. It may be a stagnation for hours or for days, maybe for a week also. Because the stagnation may be in a positive way that we are trying to cure their allied issues also. And we are trying to focus that allied issues should not aggravate. So this is a way that we say that there is a stagnation. Okay. And another thing is misconception. What Karthik said, forward bending should not be given for lower back. But unless otherwise you make them do some work. See, you can see the best example I can refer the elderly people, right? When you ask elderly people, don't do this activity, don't do that activity, immediately what the elderly people will say, grandma will say, don't make me sit. I have to work. If you make me sit, I'll sit permanently. Right? This is a thing that many our ancestors used to say because these are all few misconceptions they have. What our ancestors has taught to us is if you have a habit of climbing the staircase, you can climb the staircase even at your 90s. If you stop climbing the staircase for at least for 6 months, after 6 months, if your house is in the second floor, you will find it very difficult to grow. At least for a week, we will find mentally we would be very tired. I have to climb really 2 floors to reach my home, right? So this is a misconceptions are there. That misconception should be avoided. And then is the promoting a marketing strategy. In each and everything, we need a marketing. The world is dominated by marketing. Unless otherwise there is a marketing, we will not know the product at all, right? If you want to publicize the product, you need a marketing. And then a profession. The profession, naturally a profession. Everything has become a profession and everything is followed with the professional ethics also. And another thing is the main thing is the overcome a problem. See, any problem that should be resolved. Problem should not be allowed to stay as problem forever. We need a solution for it. And next is that, as Rajeshwari ji said, we have to do something useful to the society. Whatever the society is facing a issue, whatever society is needing, and it is our duty to give them in the right time. So for all these things, we need a research. And what would be the next week? Just talk about the nature of the research. So what are all the specific plan and the procedures that we'll have? Simply, you cannot start on research, right? Even in our university, what we'll do when you go for a research, you are asked to give a minimum of 5 to 7 topics, in which the university will choose one topic for it, right? So there is a proper procedure. And simply choosing a title alone is not enough, right? Many people in a single batch, you can see many 4 to 3 people with a diabetic would have taken a diabetic as a main disease. And what would be the solution? The way in his, as Nagaraj said, he has added Burma in his therapy. So I have added diet. Like many people will add some Siddha, they may add some Ayurvedic also they may add. And even in yoga, there is a different style of yoga is there, no? So that even that style they will add. So not only the independent intervention is different, even the dependent variables, that is whatever the causes for the particular disease. See, one particular person may take H1ABC, another person may take fasting, another person may take BMI level, like this. So the reasons for the things will also differ. So there is a procedure to prove something. When you take a proper research means, depending upon the procedure, the nature will also differ. And then there is an observation, the empirical evidences, depending upon the observational and empirical evidence. Everything research means you need a evidence. With the past evidence, the future will get continued. And then we will provide a valuable facts. As I told, no, facts are very much important. What would be this? Now, today I am just giving a scope of it. Please do not misunderstand. This is only research. The research chapter is only this much. There is a vast things are there. I am just trying to give you an outline. Since it's a first day, I don't want to hold you much. So simply outline only I am giving. Okay. So now the scope of the research. With the scope, we will end up today. I don't want to hold you much because already night time. So what would be the scope of research? As we have already discussed, scope is mainly to resolve the social problems and also for guiding the social planning. Anything related with society alone, we can do it. We ourselves cannot make one research with a single person or with our simple family or with our friends. We cannot do any research. Any research would be based upon only other social current problems. As she said, when during the COVID period, we could have seen many people did the research with the COVID only. So like the society, what the society is needing, what the society is facing the problem, that problem to be resolved. Then superstitions to be avoided. You know, previously, whenever we got a chicken box, they have not gone for any proper treatment. Like simply they'll go to a temple and put the prasada in that. So they were believing so. And even for childbirth, on many things they believed only these superstitious belief. Later on only they have understood simply with the prayer or certain things. Sorry. Some problems cannot be solved. So they started giving the medication, the oral medication, everything later on. So such a sort of superstitions to be avoided, especially with the psychological issue when it comes to the anxiety or the stress level. When the stress level is good, when they get into a depression, generally what depressed people will do, they isolate themselves or they'll have an extreme emotions, right? Okay. So previous days, what they did now, they would have taken them to some pujari like and pour some water and do the traditional way of treatment. And do you think the depression would have got resolved with that? It might have aggravated only because the particular individual is exposed to that he is not all right, right? But depression, nowadays, what we are doing, what is the reason for the depression? We analyze, we give breathing, we give the meditation, and we give the proper pranayama so that the pituitary is getting activated normal. So this is such a lot of superstitions to be avoided. And then to protect the social welfare, always all the research will be based on only the society. Without the society, without aiming the society, without with the intention of helping society, we cannot do any research. We will not get the permission also. And then Deepika, I think you are joining now, right? If I am right.
Yes, ma'am.
I'm not understanding.
Yes, ma'am. I joined,
Yeah,
ma'am.
almost the class is over. Try to maintain the timing, madam. Okay.
Yes,
And
ma'am.
then one is it has to provide a new knowledge. That is everyone will. So whenever, as I have already told you, unknowing to known. Research is the main aim of research is that you do not know something. With that, you are finding out a solution. You are coming to the known thing and verifying the old fact. So many research nowadays verify the old fact also. See the research that has done before, and even with the sugar, there is one previous, I think 2014. I read one research paper in which it said that just 2 times a long gap in intermittent fasting, like 10 o'clock if you eat, and then if you eat in the evening 4, that long gap is helping them to maintain the glucose level because the digestion level is better, churning level is better was on paper. And previously what has happened, everybody said when people say diabetic, you should not eat stomach full one time. With a gap, doctors advise them to eat. See, the previous facts are being verified in the second research, right? But nowadays the focus is something different. When people say diabetic, nowadays people don't depend upon the medicines or the simple way of treatment alone. Nowadays the planning is going for reversal of diabetic, which we yoga people were really doing. No, that is the physical workout and the regularization of diet. This is a current trend of diabetic. And then what is happening is intellectual joy. See, whatever the solution you should give, it should be intellectual solution. It should not be a normal solution. Like, so we should put an effort to find out a solution. And naturally, it has to be a livelihood solution. And next thing is that we should not give any false facts and figures. Like if I am giving treatment, if your treatment period is for 6 months, if you are giving some treatment, and if the treatment is worked out, if you are giving treatment for 30 people, for example, if it is worked out with 25, if it is not worked out with the 5, you should give only the fact. You should not manipulate the data. Because the 5 might have had some allied figures or some reason that it has not worked out, which we have to find out again why it has not our diet or the way in which we have given the therapy has not suited the 5. So that should be that we have to do as an extension research with the permission. But the 5 data should be given the fact. We should not manipulate. That is a proper way of doing a research. And then needed for, see, you have to discriminate means here you have to judge the things correctly. See how you are judging the things correctly. It is not with the assumptions. We are proving with the scientific facts and figures. With the data reading we take the average out of it. We do t-test, we do ANCOVA, we do ANOVA. So we do many tests and we are judging out the result with the tables. Whatever the tables already available, with that we are comparing with that. And then with the advice of the medical doctors in our guide and the team, we are finding out, judging whether this treatment is good or not, and improve teaching and the learning process. Naturally, research is needed to improve the teaching and the learning process. So unless you know the answer, you cannot teach to someone, you cannot suggest to someone. So I think with that, I may end up the class today. So any questions, you may ask now.